Hello and welcome back to ECR Live. We broadcast from Europe's largest radiology congress, the ECR. And one of our major sponsors is Siemens. I am at the Siemens booth now and we'll talk with Mr. Bolle about magnetic resonance. Hello, welcome.
Yeah, welcome at Siemens MRI here at this year's ECR in Vienna.
Thank you very much. First question, Mr. Bolle. What's new in your area, which is the MRI? What's new?
So our focus this year, and I think this is a major focus in MRI, is body imaging. Yeah? Historically, MRI always has been very strong in neuro and musculoskeletal imaging. What you're now going to see for the first time that MR will play a major role in body imaging. This is due to a new technology which we're introducing. The technology is called FreeZit. And FreeZit really enables you to be, for the first time in MRI, fast enough to really allow robust and very high quality body imaging in this area where you are in constant move. You have breathing, you have peristaltic moves, yeah. The liver is really very complex in terms of vascularity, so it was always difficult for MRI to handle all these processes and reliably produce high image quality. Now with FreeZit, this is fully under control. So on one side, FreeZit offers you very high temporal resolution, so you can do examinations where you basically every 2.5 seconds acquire a complete liver data set. Meaning when you have your arterial blood flow coming, you can basically all the time acquire every 2.5 seconds a complete data set, and there's never ever that you're gonna miss an arterial bolus. You're always gonna have the full understanding where your primary tumor is and where your lesions are. Yeah? So I think this is the best information you can get to be able to plan your treatment path for the patient in oncology. I think liver is the most difficult organ. Of course, the FreeZit technology can be used in other areas like breast imaging, prostate imaging, yeah, where it also has its major benefits. The second part of FreeZit is that you can cope with patients which are very sick. Patients which are very sick, or the very old patients often have oncology diseases, unfortunately sometimes also kids. All of them have in common they cannot hold their breath. So what you really would like to do, you want to scan them while they are breathing. And now with FreeZit for the first time, you can acquire all this information in free breathing. Yeah, so you get crystal sharp diagnostic imaging while the patient is breathing, while other movement is there. And I think this is a major benefit that all these patient groups are now open up for MRI, and of all of them, we can really high quality information offer to the referring physicians.
All right, now, what are the clinical results?
So let's look at the clinical results. I have a little display here, so if you want to follow me over.
Absolutely, let's go ahead.
So just as an example, you can here see, for instance, this case was done every 3 seconds, so you have 3 arterial phases, basically where you can see the primary tumor or metastasis really nicely lightening up in the arterial phase, and then you get your portal venous and hepatic venous phase. So the entire examination for this one is exactly at the same time like a CT image, because it just depends on how the vascularity of the liver is. Yeah? Just the inflow, arterial inflow, venous inflow is happening, and MR follows on time like a CT scanner would do. Afterwards, of course, you could then have some diffusion scans or something to get additional information about the function and really characterize the lesions if they are benign or metastatic. I think what is very important with this stuff, that you can get very early information, for instance, if you want to check if a treatment works. So in chemotherapy, you have a first chemotherapy, maybe a second or a third, and you want to find out very short, is this chemotherapy really working for this patient? Mm-hmm. With MR, you can, in very short intervals, get exact data and then switch your therapy to a different approach, and then really, I think, be able to make the right decisions to save more lives for our patients.
That sounds like a real advantage for patients. What other benefits for the patient does it have?
So there are 2 things, basically. I think one is the diagnostic advantage. I think this is in the focus. We want to provide the best diagnostic to really help our patients best so that they can be treated and get healthy again. But the second thing in MRI is really about patient comfort. Mm-hmm. Nowadays, on some markets, you want to attract private patients to your private practice or to your hospital. On the other side, reimbursement nowadays is really rated on, or is leveled on patient satisfaction. So patient after examination rate your experience there, and then afterwards your reimbursement depends how satisfied the patient was. So therefore all the other features coming in focus. And that's why this year Siemens is introducing Quiet Suite. And let me show you how this works.
Let's go.
So Quiet Suite addresses one other major topic in MRI. Due to the sequences we are having, MRI examinations are very noisy. Usually patients come out and they feel quite stressed due to the noise. They have to wear earplugs all the time. Yeah. So I think MR is pretty noisy, and this is something which is uncomfortable for the patient. Yeah. So what we introduced this year is basically a sequence-based technology which enables us really for complete examinations in neuro as well as in musculoskeletal imaging to offer quiet examinations. So we can reduce the noise sometimes down by 97%, so meaning this is getting close to inaudible. I think overall the noise is reduced by more than 50% for the entire examinations. The good thing is the length of the examination stays the same, so there is no extension of the examination, and also the image quality exactly is the same. So there are no compromises on image quality. Everything technology based is based on sequence technology, so that the sequences are adapted and are not so noisy anymore. So both things, the body imaging with FreeZit and also the Quiet Suite, are available for our two flagship products, Magnetom Skyra and Magnetom Era. Both come as software upgrades, not only for our new customers, but they're also available for our all installed base customers, so that they also can grow their patient population and serve their patient population better than they could have done so far already.
All right, Mr. Bolle, thank you very much for your time and this interview. Thank you.
It was my pleasure.
Thank you. We'll be back at 4:15, and coming up, ultrasound. Send us your questions. Thank you for your attention and stay tuned.